Oxygen therapy. Oxygen therapy, first of all, you have to know the air contains 20% of oxygen. So, everybody in the world is living in 20% oxygen. If somebody gives 1 liter oxygen through his nose by nasal cannula or face mask, it will add 4% oxygen. So, a patient is sitting in the bed is taking no oxygen, that means he is in 20% oxygen, but a person is taking 1 liter of oxygen through face mask, so it means that he is taking 24% oxygen. So each 1 liter oxygen adds 4% oxygen. 2 liter oxygen means 28% oxygen, 3 liter means 32, 4 liter 36, 5 liter 40%, 6 liter 44%, 7 liter 48%. So if somebody want to take 100% oxygen, how much oxygen he should take? He should take 20 liter oxygen. 20 liter means 4 into 20 equal to 80% plus 20% in the air. Right, this is clear. If anybody have got oxygen should not be given in the hospital in Bangladesh. Particularly, I have seen that somebody comes with anxiety disorder or stress disorder or convulsion disorder, we always give him oxygen. Or if somebody shows that he is suffering from dyspnea, we give oxygen. But oxygen should be given when saturation is low. So when saturation is low, you must give oxygen until and unless saturation is more than 95% or normal. But in case of COPD, oxygen should be corrected to 88 to 92%, not more than this. So let us think about devices. Here it is nasal cannula. It can allow 6 liter of oxygen, that means 44% oxygen. 6 liter means 4 into 6 equal to 24 plus 20% oxygen in the air. Okay, so nasal cannula 6 liter, it's okay. 6 liter means 44%, and face mask can allow 10 liter, that means 60%. And reservoir bag, this is a face mask with a reservoir bag, tight reservoir bag. It can allow 95%, that means 19 liter or 20 liter of oxygen. So if somebody is putting nasal cannula, you should not give more than 6 liter of oxygen because it will be lost in the air. Patient is capable of taking oxygen only 44%, 6 liter. If you give face mask, you can give 4 liter, 5 liter, 6 liter, 7 liter, 8 liter, 10 liter, it doesn't matter. But if you give a reservoir bag, the patient can take 95% oxygen, almost 20 liter. You see, this is a Venturi mask. Venturi device is attached here, and other Venturi devices. It is given for fixed low flow oxygen, such as long-term domiciliary oxygen therapy in patient with COPD or patient with DPLD, or a patient with post lobectomy, or a patient of sleep apnea. Such patient who should take controlled oxygen therapy, such as it can allow 60%, that means 10 liter, up to 10 liter. Some of the device can give only 24%, 28%. So for fixed flow, you should use this Venturi mask. You will know in the detail. So portable and non-portable oxygen concentrator machine. This is an oxygen concentrator machine. This is in the room, and it is taking room air to concentrate oxygen within the machine and supplying to the patient. So there are oxygen concentrator machine available in the market for a patient. This machine, you see, 5 liter oxygen. This machine can concentrate 5 liter per minute oxygen, and there is also big machine or small machine or portable machine. The people who desaturate, whose saturation become low on exercise or walking, he can buy a machine like this, and he should not buy the bottle or cylinder of oxygen from the market. He should have only a oxygen concentrator machine. And see, continuous positive airway machine, continuous positive airway pressure ventilation. This patient is having continuous positive airway pressure ventilation. If patients have low effort for inspiration and expiration, in this case oxygen should be given to pump into the trachea. This is a high flow humidifier oxygen machine. It blows oxygen very fast, and it also humidifies and oxygen within the machine. And lastly, you see non-invasive ventilation. That means not without intubation. This is a helmet mask. You see helmet mask. This machine pushes oxygen within the helmet, and the patient breathes both in and out within the helmet to take oxygen. This is given in patient who is effortless on breathing. And this is final, the intubation and ventilation, when anyhow oxygen cannot be corrected, and there is also acid base balance. This type of patient, or who are unable to breathe in anesthesia, this type of patient takes this intubation and ventilation. So this is all about the oxygen therapy, and thank you so much.